In a second here.
Okay. And I'm going to go ahead and get us started. And I wanted to welcome all of the educators who are in attendance this evening. And we are in webinar mode. So I know that I already have a comment that you don't know whether you're muted or what, but in webinar, you don't have, you are all muted, and just the panelists are able to speak and to be seen on screen. So yes, we did this format in webinar, but I did receive tons of questions prior to this evening, and so with that, I will get started. We are so lucky this evening to have our good friend and partner in this COVID-19 disruption to all of our lives. We have Dr. Stewart with us, and we also have Dr. Scrase. And I want to welcome both of them, and I know that we have some tough questions for them, and we are going to ask them those tough questions. But I also want to just start off by saying we could not have better people running our state agencies than these two people here. I know that this could have been so much worse across the state if we wouldn't have been if we didn't have the leadership that we've had at the state level. So with that, I am going to turn it over to Dr. Stewart. And Dr. Stewart, I don't know if Dr. Scrase is going to go first or if you are going to go first.
Mary, I'll say just a few words to start, and I know there's a lot of questions as well. But first off, I just want to say thank you to you as always for making this forum available. I know we've done a number of these town halls throughout the pandemic, and always appreciate the opportunity to be here with NEA and all of the educators who are here and have these conversations and get some of these questions answered. So again, I appreciate that. Appreciate the partnership here, the advocacy that you've had. And we are just a couple of days from the end of the session. And so just a couple of quick things about session, if you don't mind, Mary, because I know that there's a lot of issues related to education with regard to the session. And I would have said a year ago today, we're likely headed for some significant cuts. And, we have a really dire budget projection, and this is going to be a really tough year. And it has been a tough year, no doubt. But coming out of the session, I think we are looking forward to increased investment in education, significant increased investment in education, and also some really important gains for schools as we move forward. Enactment of the end of the impact aid credit without having to take that money from other districts, but being able to backfill it. That's a big move that we're excited to get across the finish line. We have the family income index, which is, I should knock on wood here, going to the House floor, and we're looking forward to a hopeful passage there, a strategy to really attack concentrated poverty. And we appreciate NEA's support in moving that forward. We have, in addition to that, more flexibilities, which are being offered in our extended school year programs through a couple of different bills, one of which I think is still awaiting its last committee hearing. And so there's a lot of investment that's going into education. Community schools is getting a major investment into a community schools fund that will make sure that we have a strong base of support for that going forward for many years. Career and technical education as well. So we're making a lot of really important investments here. And I don't think we would have said that we were going to be doing that a year ago. So this is really important. And of course, incredibly important, and due in no small part to your advocacy and the advocacy of so many educators, is we're able to get all of our educators vaccinated. And so it's been great to see that happening and moving forward. And I just want to thank Department of Health for all the work that they've done in that. That is a huge step And we know that something that is going to be critical as we continue to move forward. So thank you for your advocacy and partnership and helping to make that happen. And I'll stop there. And Dr. Scrase, I don't know if you have any opening comments that you'd like to offer.
Well, I just really appreciate the chance to be here and talk to you all tonight. My job before the job of Secretary of the Human Services Department was being a professor at University of New Mexico Medical School, and I consider myself an educator as well, and spend a lot of time on finding new and better ways to educate medical students and residents. So appreciate everything you do. We still have a son in school, and really are thankful that you all are have been there on little screens or big screens since the beginning of the pandemic and all the way through today. And we're excited to answer some of your questions today, dialogue a little bit about the interesting aspects of the pandemic and the safety of return to school that you're asking. So I'm looking forward to answering those questions today.
Okay, well, with that, I'm going to just give a little bit more about the webinar overall. So we had our folks from across the state submit questions, and a lot of those questions I sent over to you, and I did receive some others that if we have an opportunity, we'll ask those. And I know people are putting questions in the chat, and we are more than likely not going to be able to get to the questions in the chat. But what we will do is we will get the questions answered, and we'll send them out to all of the attendees at the webinar tonight. We know that there's a lot of anxiety with the vaccination and with the announcement on March 8th that schools are returning to full in-person. And that's why we're having this webinar, so that you have an opportunity to get information that you may not get. And so with that, I'm going to go ahead and start the questions. Does that work, Dr. Stewart, or did Dr. Scrase? You know, when we spoke last time, we talked about the fact that educators do have a lot of, they have a lot of questions around that schools are safe. The message that Dr. Scrase gave at the Ring the Bell press conference that you did. And so I really wanted that case to be made to educators because there's a lot of unease around that. So would Dr. Scrase like to do that, or should we just get into the questions and we'll do that as we go through? What would be your preference, Dr. Scrase and Dr. Stewart?
You know, the questions ask that very thing. So if we just want to go through the questions, we can answer them briefly and take follow-up questions then, because I think that is covered in the yellow highlighted questions I have to answer today. Okay, so I'm going to go ahead and get started with the questions, and these come from conversations that I have with educators every day. And so this question came in. Our principal just announced the pandemic is over. How would you respond to this?
I'll take that to start, Mary, and Dr. Scrase can certainly weigh in with his thoughts, but I think it's very clear, and you listen to all of the conversations with all of the public health experts, and we are not over this pandemic. There clearly still are risks that we have to be very much aware of. There's still the biology of the virus hasn't changed. We're making good headway with the vaccination program. But we're still early in many phases when it comes to fulfilling what President Biden has put out in terms of the number of vaccines and getting them available to every single person in the country. So the pandemic's not over. We have to stay vigilant. We have to keep taking the precautions that we've been taking, and any statement to the contrary undermines what it is that we're trying to do. I think we've done a really good job with schools so far and making sure that we're containing the virus and not seeing massive outbreaks of the virus in schools, and we need to keep that up.
Yeah, and I would just add, I agree with everything Ryan said. You know, the pandemic is not over. This is really a struggle between the virus and its many forms and humanity. And letting our guard down now would be an enormous mistake. So we have to be vigilant. We have to still wear masks. We have to take all the precautions that we've set up in schools and in other settings. And we need to realize that the virus is just as infectious as it was on our first case on March 11th. You know, we had 5 people die today from COVID. I don't think that those folks' families would be glad to hear that the pandemic was over. It certainly isn't over for them, and a lot of folks out there who are really going through this still. And so we have to keep our guard up. We have to stay safe in the things we do.
Okay, thank you for that, those answers. Second question, on Monday, 3/8, and I don't remember when that was. Time is just flying by. At the Ring the Bell press announcement, Dr. Stewart made the comment that districts need to use social distancing to the greatest extent possible. Many schools in New Mexico have more students attending them than what the school was designed to hold. When schools reopen to in-person instruction, we will not be able to keep students 6 feet apart in many cases. Is social distancing no longer necessary to stop the spread of COVID-19?
Well, I have an academic answer to this question, and I'm going to share my screen. This comes from a study done at the university. Oops, let me, just a second, sorry. Let me try that again. I started the presentation, but I didn't get the screen up there. So let's try one more time. Click there. Okay, now I'm showing my screen. I'll make this bigger. This is, so the CDC guidance, official guidance says spacing, seating desks should be kept at least 6 feet apart when feasible. In the state of Massachusetts, they looked at the incidence of COVID in public schools with different physical distancing requirements. So it wasn't randomized, but they had schools where kids were more like 3 feet apart and schools where kids were 6 feet apart. Everyone was masked. This is a good size study, 537,000 students, almost 100,000 staff involved in in-person instruction. And so this was 6.4 million student learning weeks and 1.3 million staff learning weeks. And basically what they found was student case rates were similar with 3 or more feet versus 6 or more feet. And they found that there wasn't really a significant difference between the two, and staff cases were the same. And so the graph here, can you see my pointer moving? The yellow is student cases at 6 feet, and the red is student cases at 3 feet. They just sort of overlap. And the green is staff cases at 3 feet, and the dark green is staff cases in the blue. Sorry, green 6 feet, blue 3 feet. So really no significant difference. I think, remember too, I know you have challenging conditions when you already have more kids in the classroom than the schools were built for, but there will be a defined percent of kids we anticipate that will still remain at home even when schools are open. And so that needs to be factored into the distancing equation. While I'm on that subject of distancing, really want to enlist all of you to take great care and pay really close attention to what's happening at lunchtime, because we really don't want kids in closed spaces close together, masks off, talking loudly while they're eating. And so to the extent possible, we can spread kids out and get them outside. As Dr. Stewart has repeatedly said, that would be great. Thanks.
Yeah. The only thing I would add, and I know we've had these conversations, Mary, too, about involving teachers and communities in the design of how do we utilize all of our spaces that we have in our schools, including our outdoor spaces, and creating environments where we're able to take advantage of that more often than we have before. It's certainly something that we're emphasizing in all the conversations we have with school and district leaders about how ways that schools can be thinking creatively about utilizing those. We've even tried to push utilizing some of those federal funds to help make some of that possible. And as we get into these warmer months here, I think we have significantly more opportunities to really leverage that. And so we're going to continue to encourage as much as we can to make use of all of those spaces as well.
Okay, and with students attending, thank you for those answers. With students attending a 5-day week, how will buildings be cleaned properly to keep students who haven't been vaccinated from getting the virus? Is it best practice for schools to be cleaned 2 times a day? I don't know where that number came from, but so if you'd answer that, please.
Yeah, I'll jump in on this, and Dr. Scrase can add as well. So as we go forward in the guidance that we have, which is still available on our website, you can go and download both our COVID response toolkit as well as our main guidance document. And so in there, all of the CDC recommended cleaning supplies are still there and listed and required for schools to be using as their cleaning surfaces. And there are still the same guidelines around cleaning your high touch surfaces every day. We know that through the federal funds, we can see in our budget portal how much of that gets budgeted for things like PPE or cleaning supplies or the fogging machines that many districts have purchased, and many of the other kinds of supports for decontamination. And it was running about 30% of the federal funds. So in the first round, it was about 30 million. In the second round, it was probably about 4 times that. A significant amount is being invested in making sure that these products and these types of equipment are available and in use in schools. And so as schools are coming back, those expectations around continuing to wipe down those high touch surfaces, continuing to provide hand sanitizer, continuing to make sure that you have those supplies in bathrooms and other parts of your building, those are still there. I can't comment on the best practice question about 2 times a day like you, Mary. I'm not sure if that's referencing a particular study or exactly what that is, but we do know that, and as I've visited and talked to many of our custodial staff around the state, that they're constantly moving throughout buildings, constantly wiping things down, visible presence as you walk through the buildings. So we do still have high expectations around keeping those practices going.
Yeah, I don't have too much to add. I would just say that at the very beginning of the pandemic, there was an extraordinary emphasis on cleaning and an extraordinary concern that there was meaningful levels of transmission on surfaces. You know, any kind of respiratory secretions on surfaces that are touched, and then if you touch your face, can transmit pretty much any virus. But the role of surfaces in COVID transmission is seen as relatively minor now. All that being said, kids do have a lot of spit, saliva, and things like that. And so keeping things clean is still a very good practice. And I've read nothing at all about cleaning twice a day that would suggest that would add any additional benefit. Thank you.
Okay, so I just want to talk to some people attending our webinars. So I have been working with Dr. Stewart since the moment he took this job in New Mexico. And I have found Dr. Stewart to be a straight shooter. I have found him to be very honest and to have a tremendous amount of follow through. And I understand that some of you do not see what Dr. Stewart has implemented, because you are in a small district somewhere that doesn't necessarily, you know, what he talks about and what your experience has been maybe very different. But I can tell you this, that conversation, if what you're hearing Dr. Stewart and Dr. Scrase say, if you're not seeing this at your school, you know, because I am monitoring the chat, you know, somebody said we don't even have soap. Well, that is a local problem that needs to be addressed locally, because getting to our next question, I will give Dr. Stewart an opportunity to talk about the money that has gone to local districts to get in place and prepare for the reopening of schools, which we all knew was going to come. So in Dr. Wyman, and I would just take this opportunity to introduce Dr. Earl Wyman, our executive director. He told me I shouldn't even ask you this question because this is a local district question also, but about how many extra custodians, substitutes, and hall and school lunch monitors have been hired to accommodate in-person learning during COVID. But he said you would be able to address how has additional funding been given to schools to hire extra people. So I will turn that question over to you, Dr. Stewart.
Yes, and excuse me. This is actually a really poignant time to start talking about additional funding, because as many of you know, the $1.9 trillion coronavirus relief package was recently signed by President Biden. And of that, it allocates a little under $1 billion to New Mexico for schools. So to give a background on the different federal funding packages, there was the CARES Act that was passed back last spring or early summer, and that was about $130 million for New Mexico schools. And then what we call the CRRSA, the Coronavirus Response, I forget exactly the acronym, CRRSA. That was passed in December. That was another $430 million for schools. And now this new round of federal funding, which is called the ARPA, the American Rescue Plan Act, that allocates an additional $979 million for schools here in New Mexico. So these can be used over the next 2.5 years. But what you're looking at is about, in total, an additional $1.5 billion that's been put into schools specifically for the purpose of being able to reopen and bring our students back and do so safely in COVID-19, coming back from the school shutdown that were required because of COVID-19. So that's some context around how much money has been in each tranche. And so the newest package that just got signed, so we'll be rolling out and making those funds available. But I say all this to say that there are significant funds available to address exactly these kinds of issues. And it's certainly, I would encourage ongoing dialogue and conversation with your school and district administration about how those funds are getting used and how you can work together to make sure that they're getting put toward creating safe environments. So with all that being said, there's a lot of money to make sure that this can work. We fully expect that we are attending to keeping a safe and healthy environment, but also closing digital divide for any students who still remain unconnected, and that we're also being very attentive to the social and emotional well-being of our students as well, and providing those additional counseling services and professional development opportunities for staff around social and emotional learning, and keeping our students engaged, those who have been disengaged since we've had to be apart. So there's a lot more to come. This funding is the latest round of funding, at least, is still pretty new. But we do know that money is earmarked to make sure that we can come back strong from the pandemic.
Thank you, Dr. Stewart. And so this question I have received a lot and from all over the state, and that is why are you putting, and they use ADA, the Americans with Disabilities Act, teachers that qualify or feel like they qualify in that designation at risk by taking away their accommodations?
Yeah. And this is a really important question. I think one that certainly I feel very, very strongly about personally in how we do this and do it with an approach that really puts concern around this virus at the center. And I'll be testifying actually in a case tomorrow where we're getting sued over the accommodations that we have put forth for teachers, where school districts have reached out and said, you don't even have the authority or the right to have put what you have put in place so far into practice. And we just very strongly disagree both on legal and moral grounds, which is why throughout the pandemic, we've said that all teachers who have these factors that are identified by the CDC for at risk automatically qualify for an alternative work assignment. As we go forward and move through the vaccination program, we know that these vaccines have been very, very effective, both at preventing people from catching the coronavirus and also preventing the serious risks of hospitalization and death that can come with it. And then I'm sure Dr. Scrase can talk more about that particular piece of it. So what we've said is those teachers who fall into those categories remain on those automatic exemptions all the way through until the 2 weeks after the final dose of the shot's been made available. And at that point, the ADA accommodations don't go away. They just become a conversation between the employee and the local employer. So the state no longer puts that restriction, but the conversation between those two parties does continue. So again, we take that very seriously, and we have throughout the pandemic, even though again we're getting sued over it, and well, if that's the what we need to do, we'll certainly defend that in court and push for it because we think it's been important, and we think that keeping that in place through full vaccine efficacy for those highest risk employees has been important. And Dr. Scrase, I don't know if you have anything to add on that.
I'm going to talk a little bit more about the vaccine later. I think it's the nature of public health that when there is a statewide or countrywide or worldwide intervention, that the people getting the, in this case, the vaccine, think of it from a very individual perspective. I am getting protected from this vaccine, but the vaccination for COVID is a very dramatic and very effective public health measure as well. Like every person on this call is safer each time one of the other people gets the vaccine. So it isn't just for personal protection, it's for community protection. I have some data that I'll get into later on immunity first, second dose. But when we modeled all this and made the announcement, it was not contingent on vaccine. We said schools will be safe to return. I think in healthcare, we figured out how healthcare workers could work without a vaccine for 10 months and with proper protections and precautions. And so our, to me at least, from the scientific perspective and the community case rate perspective, the vaccine is more about everyone being safe, schools being safe in general. We have some modeling I'll show later that gives some more detail.
Okay, thank you. So this is a question, and I am right in here too. And I know once educators opened up, and when President Biden said that educators were being made a priority, and I think more vaccines started coming to New Mexico. And New Mexico is a state that is the second highest in getting the vaccination out to people, correct? Like we've done a really good job in getting the vaccine out. But I know that like I got my first shot like this question here, and this says CDC guidelines state that people are considered fully protected by vaccination 2 weeks after the second dose of the Pfizer or Moderna vaccines. The mandated return date of April 5th falls 12 days before dozens of educators are considered fully protected according to the CDC. Why are we being asked to return before developing full immunity?
Yeah.
And and I know, like, I get my second vaccine on the 28th of March, and many educators are in that same spot and just wondering, and I've had a lot of questions around that.
Yeah, and we've gotten a lot of questions around it too, Mary. And I would refer back to something that Dr. Scrase said just a second ago, which is, why are we making this return to school? And Dr. Scrase and his team have and the Department of Health, they have a whole unit of people who have been just study after research study throughout the whole pandemic and looking at the trends. And Dr. Scrase has convened a modeling team from Los Alamos National Labs, along with our epidemiology team, who's been studying both what the trends are internationally, nationally, and here in New Mexico, and creating data models for how that's been playing out across the state. And I think the big upshot of all of that is we're returning because what we've seen is that the practices we've had in place during this are working, and the infection rates have been coming down at a strong trajectory, and it's allowing us to return with the conditions that schools have often been showing to be safer places than the environment at large. And so that's a big reason for the return, even before we start thinking about the vaccines. Now, because of the advocacy of organizations like the NEA, and because we've made strong headway in vaccinating long-term care facility residents and medical professionals and the sick and the elderly, and we have an increase in supply, we're able to prioritize our educators to get all of our educators and school staff vaccinated as well. That's another big step in, as Dr. Scrase said, every time somebody gets that shot in the school, it makes everybody in the school continue to be safer. But again, schools have been shown to be safe even before we take that vaccine program into account. Just for context, in New Mexico, through our surveillance testing program, since we expanded in-person learning back in early February, and we had significantly more students come back into the building, our surveillance test positivity rate has been hovering around 0.3%. And so one of the things that we have to balance is when we look across the state and we see so many students who, this has been very, very hard and who have struggled and who really need to come back. When we see so many families who look both at their students and the struggles they have and trying to support them and make remote learning work, but knowing that they need something more to come back, we have an obligation as a state, and that's why we're all here. We're all educators because we love working with our kids. We love being with our students. And we know how important it is to have that face-to-face learning option for them. And so when we look at that data, when we look at the effectiveness of our COVID safe practices, those very low positivity rates, the fact that it's working, we do feel an obligation to make sure that when we feel that, and the public health officials say that you can do this safely, CDC says you can do this safely, WHO says you can do this safely, that we have that obligation to make that critical service to our kids available to them in person. I'll stop there. And Dr. Scrase, did you want to say anything more about immunity?
I'll talk a little bit about the vaccine effectiveness against variants in a few minutes, but I just echo everything you said. Schools in the modeling are safer. Our experience with infections And teachers, staff, and kids that have been in in-person school in the fall was that the vast majority of those infected seemed to acquire the infection where we could tell outside of the school environment. And you're right that Lionel really did model that. And one of the decisive factors was the return to school. When we went back to hybrid and announced that in January, kids would actually be safer and have lower chance of acquiring COVID in school than they would out in the community.
Okay, and this is a kind of a longer setup for the question, but this is a middle school special education teacher. And I have several students who want to remain remote, and many of them have family members with health conditions. I'm worried that I can't support these students when I will be in person full time, focusing on my students on campus. This will be a huge adjustment for my students, especially those with autism, as they will now have a completely different routine, and I will not be available to them like before. I'm very concerned for the special education students in our state who remain remote and will potentially lose their critical support and entitled service time. How are we going to support special education students who choose remote, as well as their teachers who are working online and in person? And I really like this question because number one, you can tell it's from a real educator, because just thinking through, how incredibly difficult it's going to be with the population of kids that this educator teaches. So I'll turn that over to you, Dr. Stewart.
Yeah, a really important question, and we'll be very clear that there is not an easy answer to this type of question. So we know that our students with autism, and many of our students, but especially our students with autism, really thrive on routine. They really thrive on consistency. They really thrive in structured environments that are familiar to them. And during a COVID-19 world, all of those routines, consistencies, ability to build relationships with people have been thrown into disarray, and it's really been hard. It's been hard on everybody. It's been hardest on our students with special needs and our students with autism. And I really appreciate the question from this teacher, and I wish I could just say, follow step A, step B, and step C, and it will be very easy to continue to provide all of those same services. We all know that that's not the case. We've all had to learn different ways of interacting, oftentimes simultaneously working with groups of kids in front of us and groups of kids online, or working with a group of kids in front of us while the kids online are doing asynchronous work, and then coming back to support those students who have questions in their asynchronous work, and switching back and forth. And that's not, none of us went to a teacher education program where that was the model. At least I know I certainly didn't, and I'm sure most of the people on this call didn't either. And it has been an incredible learning curve. I've heard it from every teacher that I've talked to, remote, hybrid, that, blurring the lines and the difficulties that are there. I have seen in many of the classes that I've had the chance to attend, both virtually and in person, educators doing some really great work here, who have their kids online, who have their kids in front of them, who have been doing it for months now, and have gotten down some of the rhythms of what that looks like. And it's not easy. It requires different types of planning, and we've seen schools where they make different decisions about how they organize around that. Some have dedicated virtual staff and then dedicated online staff, and they've made that local organizing decision as to how they arrange their classes and their rosters to focus on one or the other. It looks different in every building, and I'm certainly I'm not sure who submitted this question, exactly what that context is, but we know that We do have educators who are doing this and making it work every day. We're trying to, at the department, give as many highlights and tips and resources for this as we can. But it's not going to be, I don't want to sugarcoat it and be false and say that it's easy or that there's a quick and easy answer to it.
Yeah, there clearly isn't. Thank you for that answer, though. How much do we know about the new variants of the virus? And does the return to school plan take into consideration the new variants of the virus?
I think I'm going to start with that one. And we know a lot about variants of the virus. New Mexico has been following viral variants for a long time, since the beginning of the pandemic. We are 7th in the nation in the number of samples tested, which is pretty extraordinary given our size as a state. One thing to say also is, I think many of you, I hope very many of you, get a flu shot every year. And every year, that flu shot is adjusted for new influenza virus variants. And so this concept of variants, at least in influenza, has been around for 102 years. And every year we get a new vaccine that adjusts for the variant. So we're watching this very closely. The CDC just updated their website yesterday. I've given you a little bit of text and images of the site. I'll show you a little bit more about New Mexico, but there are, in our state, since the beginning of the pandemic, we've had 60 different variants of the virus that had major changes in the the RNA sequencing, and over 600 total changes, very minor single sorts of changes. And so we've been watching this for a really long time. We've been reading a lot more in the newspaper, particularly about Europe, where a B117 in the United Kingdom sort of came and became the most common form of coronavirus. We also are watching the failure and pullback of AstraZeneca's vaccine, which is primarily in use in Europe. So I was just talking with someone from Norway today, and they're in a tough situation because they have a growing spread of this particular variant 117 and an absence now of vaccine availability. So they're variants of interest that are not even interesting to me, mainly just to geneticists who follow those. Maybe they transmit more, maybe there's more disease severity. And I guess I'm going to take back what I just said, because P2 is something I've been following in Brazil and watching closely. Variants of concern are where there's hard evidence that it's a more infectious form of the virus, causes more severe disease, or this is really important, it sort of neutralizes treatments like bamlanivimab and other monoclonal antibody therapies, so that we can't treat people who get a case of COVID and have risk factors and symptoms. And then lastly, there would be variants of high consequence where there's clear, strong evidence that the vaccine doesn't work, social distancing doesn't work, or treatments don't work. We don't have any of those right now. And I mentioned B117, and pay attention to that. You can see this is January, first week in January, about every 2 weeks for the past 10 weeks. And you can see B117 is growing in the United States, and that's the one that we have in New Mexico. This is also from the CDC website. You can see that this number, if you go, might not be updated yet, but as of today, we have 18 cases in New Mexico out of 4,700 in the United States. You can see this color here is 1 to 150 cases, so we have 18. And this is the one that we've seen in London. There is some evidence I'll show you in a minute that shows that the current vaccines, the Pfizer vaccine, the one available in the United States, is the one that's been studied, does have effect. This is the South African virus variant of coronavirus in the middle, no cases in New Mexico, and P1, the Brazilian, no cases in New Mexico just yet. There was a study done in England where they were looked at hospital staff, and there were, I'm not going to read all the numbers, I don't want to bore you, but they did actually report out the effectiveness of the vaccine in terms of preventing cases after the first and second doses here. And I thought I changed the colors, but they didn't stick. So in this, and I'm sorry for this is the Pfizer vaccine, but 72% of the first dose, 21 days after the first dose, sorry, and 86% 7 days after. And this was during 117, so the vaccine worked against B117. I think the other thing we're seeing with the vaccinations in our state is it is lowering the rate of infection much more quickly than the number of people getting vaccinated. And I'll talk about that more. Oh, here's another study with the first and second dose protection. And you can see after the second dose, about 94% protection. The interesting thing about these vaccines, though, is they all dramatically reduce hospitalizations and deaths, which is what we're mainly after, not just cases, but, serious cases, symptomatic cases, cases that put people in the hospital and deaths. And again, back to the earlier question about, well, don't we get more immunity with the second dose? Of course you do, which is why we don't recommend just giving one dose, but we actually believe that schools are safe without the vaccine. And as long as those social distancing measures, masking, and great care to make sure kids in particular have their masks on, as well as teachers. I could talk for about an hour and a half about variants, and you're probably already like super bored with what I just showed you. And so, but the question was, how much do we know? And so I was trying to give you some indication of how we monitor this. We talk with our lab people pretty much every other day about what they're seeing, and working with the University of New Mexico, Los Alamos National Lab is doing some of the gene sequencing. So we're in a good position for that.
So I learned something tonight, and I love that. I didn't realize that they changed the flu vaccine to accommodate variants every year. And I know I always get a flu shot now, and I hope everybody does, because it is free with our insurance through New Mexico Public School Insurance Authority. And it is, if you're an educator, you probably should get a flu vaccine. But I didn't realize that it did change every year, but I guess it makes sense. So you think that these vaccines will also change as the virus changes?
I can't see that far into the future, but I think this virus will probably, and the vaccines against it, will be more like influenza. As I mentioned, we've seen 600 minor variations just in our state, 60 more significant variations, and not significant in terms of disease, but significance in terms of change. And one of the little known facts about me that probably not even Ryan will be interested in is in the 80s, I think it was 83 and 84, the worldwide influenza vaccine contained influenza Ann Arbor, which was isolated by a pathology lab in Ann Arbor when I washed out a patient's nose and first isolated that new variant of the virus. So I've been working with variants for, I can't do the math fast enough, but I'm afraid to say it's probably 40 years.
Wow. Interesting. Okay, well, thank you, Dr. Scrase. So do we know what the long-term effects of COVID are on children? And does the return to school plan take into consideration the long-term effects of COVID on our children?
Yeah, that's another really good question and a really important question, and one that we had absolutely no information about in March, April, May, June, July, and then starting in August, we began to see some data about this. Of course, asking about the long-term side effects of anything that's only been around for a little more than a year is a tough question in medicine. And so a lot of study being done, but I'll show you a little bit about what we know. And I probably showed maybe, I don't know, 15, 20 slides on research studies on COVID in children, but let me just show you this one slide. And so we do know that a very, very small number of kids can get severely ill from COVID. About 0.06% of all the deaths in the United States were in children, human beings under the age of 18. The risk is particularly high in little kids, kids under 1, and particularly if they have underlying medical conditions. So that's an issue worldwide. There is something called multi-system inflammatory syndrome in kids, MISC, in children. And that's a chronic inflammatory autoimmune reaction, we think, but responds to usual treatment for autoimmune diseases. There is some research out now about long COVID. I've talked about that a couple times today. Long COVID, we don't have a definition for yet. We don't know exactly, in medicine, usually to diagnose something, you need a definition of the criteria for diagnosing a disease. We don't have that. We do know for sure that about 10 to 20% of people who have COVID have symptoms that last longer than the usual 3 or 4 weeks you might have with a viral infection. Now, as time goes on, we're finding out about some people who have symptoms lasting 6 months or more. There were some kids, it's a very, very small study that just came out last week, but a small number of children, 4 girls, 1 boy, that had symptoms for 6 to 8 months after the diagnosis. And I'm not going to read through the rest of the slide. Most of them had improved after 6 to 8 months, but none had been able to get back to school. Now remember, though, that the chances of contracting COVID, at least in New Mexico in our modeling, are lower in school than they are out of school. So actually, children returning to school may be something that will keep them safer as time goes on. We'll know more about that. But that's just a taste of what we know. We're following it really closely. We've had 1 death in New Mexico and a child under 18, a 12-year-old that I'm aware of. And so that is the current status of COVID in kids. And so the return to school does take into consideration long-term effects of COVID. And we believe that actually they're less likely to have those with a return to school than being out and about or staying at home in the community.
Thank you, Dr. Scrase. And I think this next question is probably for you too. And it's just to the New Mexico being a minority majority state, and that many people in the state, their culture is that they live in multi-generational family units, and may put them more at risk for COVID than others represented in the data. So are they represented in the data that you show, do you think? Is it a good match for New Mexico's populations, the data that you use?
Yeah, it depends on the data that I use. And so when I'm showing a study from Massachusetts, when we look at these studies, that's a big consideration, is how applicable really to any article for any doctor, how applicable is this study to my patients? That's the first step you go through as you're reading an article. But we do look at that really closely. We can't do all the research on COVID that's needed in the world. And so all of our modeling data comes from New Mexico. Every single shred of it is based on our own cases, our own hospitalizations, our own symptomatic and asymptomatic cases and deaths. So we do have that data, but we are well aware of the social vulnerability of our state. And I'm going to show you a slide. And this has become much more top of mind for many of us as a result of Tracy Collins Dr. Collins, the new Secretary of Health, and Dr. Laura Perrone, who is the new leader of our vaccine effort. And we do know that New Mexico is the third lowest in average annual income, which is something as the Secretary of Human Services I'm very well aware of and work on every day. We do know that we are in, I think, one of the top 5 states in terms of grandparents raising grandkids, one of the top 3 states in terms of multi-generational homes. And so, and we do look across the state. We did not have enough data for Rio Arriba, but we are seeking to preferentially vaccinate folks who live in the most socially vulnerable areas. And if you saw the press conference yesterday, Dr. Perrone did a great job talking about the mobile van that would be that went to Columbus here on the Texas border, another that's going to hatch today or tomorrow. And so we're looking at this really closely. And all of that data that we look at is related to New Mexico, as is all of our modeling data. We have a very robust sheltering program in our state that most states don't have. We've been very proactive about taking people who are in multi-generational homes who can't effectively isolate. And if they want to, New Mexico has been putting them up in hotels now since the beginning of the pandemic. Less of a need for it now. Pewaukee Pueblo opened up their resort hotel as a sheltering center for Pueblo Native Americans. That has been heavily used, and very, very active sheltering efforts in Albuquerque, Gallup, as well as Las Cruces and Farmington. And so that is something we're watching. We're also looking very closely at the availability of plumbing. But to the point of the questioner, Native Americans and Hispanics have 2.7 to 3.3 times higher odds, respectively, 1.7 for non-Hispanic Blacks and Asians, odds of being in units where it wouldn't really be possible to fully quarantine or isolate if you had been exposed to COVID for quarantine or you'd had COVID yourself. So we're on that. We watch that, and we're very, very aware of the demographics of our population. I think that's kind of one advantage of I found of being responsible for the Medicaid program and knowing so much about our state's population and those the social vulnerability index. It's great that we have that information, can use it for managing the pandemic, for sheltering, and now in particular for prioritizing vaccination.
Thank you, Dr. Scrase. So we're getting close to time. Let me just try to get this last question. And what evidence is in place that the state's return to school plan will not cause a significant increase in COVID cases? And I guess I would just add to that the spring break. We're all seeing pictures on the news of people are just celebrating spring break like we're not in the middle of a pandemic. So if you would address that, please.
Yeah, it's a good question. There will be an increase in cases with any activity, spring break, return to school, and the like. Those will follow. Again, it's more a result of community activity and the like than it is the nature of the school environment. And that's a really important distinction. I'm going to show one last time. I'm going to talk fast, Ryan, because I see there's an additional question. But we're really in a good place right now with our case counts. And let me make this a little bigger. Those of you who watch press conferences have seen this 50 times, but we're down to 190 average daily cases over a 7-day period. There's a 6-day lag there. And last week we vaccinated 13,866 people a day. So for every case we see, we're vaccinating 73 people. Tremendous ratio, tremendous formula for success. This is some of the Los Alamos National Lab modeling on where we would be on this top line without the vaccine. And it's to your point that, you know, we would be seeing an uptick in cases with everything, with restaurants reopening. Every new thing gets people together more, particularly if they have masks off, will drive up cases. The red line is where we've been since we started vaccinating people and where we project to be. We're right about here today. I think if I click this, you'll see this arrow, and we think we've had about a 60 and probably more like 70% decrease now in case rates as the vaccine has gotten out. And again, this is a community effect, not as much an individual effect. When I get vaccinated, that reduces my chances of getting COVID by 95%, that I won't infect the other person I was going to infect. They won't infect the other person. And so it is more of an exponential decline that we're seeing now as a result of the vaccine. This, by the way, was just another model of what would happen if we didn't do contact tracing anymore. And the same thing, identifying people early. We're at record quick times for doing that, and isolating them has gone a long way to control the pandemic. This is one of the Los Alamos National Lab slides. It's on the web, but you can see the modeling. This is all schools open. Los Alamos National Lab always does 10 scenarios, and I have a hard time reading the graph, so just stay with me for a second. This is case counts on the y-axis. This is if we go back to full-time school on March 1st here, given the case counts were much higher then, we would see what people in the chat are referring to as a spike. However, going back on April 1st is just the days they picked, you can see this much, much more modulated increase in the number of cases. And they also modeled May 1st. So we believed back up when we first announced the hybrid model that it would be safe. And now we have modeled the 5-day a week, and that appears to be safe as well. So that's our evidence. And plus all the evidence of our experience that Secretary Stewart talked about at the very beginning over the since September that reassures us. And then there's been a kind of an avalanche of very welcome to see medical literature starting from Europe in the summer and now in the United States in the fall and winter that reassures us of that conclusion. I'm sorry we had a run of science questions there, and Ryan, but that's just the order they came in. So back to you.
Thank you, Dr. Scrase. Appreciate the information. Yes, and the last question is a straight up education question. And it's that balance that returning to the classroom between having the pressure of the rigorous academic content and tending to the social and emotional needs of our students, which I'm sure are going to be greatly increased, those needs. So as students return to school, many grieving losses in their families, what advice do you have for educators in how to approach a balance between, content and caring for that, that social emotional need in the child, their wellness because of the experiences that they've survived?
Yeah, I think this is an incredibly important question. And I think that the students who I've gotten a chance to talk to throughout the pandemic, whether it's in the classrooms with them or in focus groups with them about how the pandemic has affected them and what their experience has been, and advice that they would give to the state about what can the state do to support you, what can your schools do to support you. And I think some of the important lessons that I take away from what the students have shared has been they've really appreciated teachers who take authentic time for kids to be able to talk about their experiences, for kids to be able to have a safe space to connect both with their teachers and their peers around the challenges that this has presented, the real grief that they're struggling through, and having that time to really connect together. I think it's incredibly important to make that time. And we know that there's always urgency. There's always a sense of urgency, as there should be, about academic content standards, maybe even now more than ever. But tending to that humanity is going to be critical. First things first, kids have been away from school for a year. And so as they come back in, they're filled with both the excitement, the anticipation, and the ability to see their friends in ways that they haven't before, to see their teachers in ways that they haven't in a year, and to have that face-to-face instruction and support that they've been missing and so dearly lacking. But they want and they need that connection, especially those who have experienced loss. And I think the vast majority of us now know somebody who's gotten very sick or who has passed away throughout the course of the pandemic. So that's going to be there. So to answer the question, my advice would be create that time, create that space, and make it authentic. It's not about reading an article and then saying, okay, we're all socially and emotionally well now. It really is about that authentic connection, which we get to do now as we bring our students back into physical proximity with us in ways that are very different than we could online. So I just want to appreciate everybody who has continued to raise the importance of social and emotional wellness, both of our families and our students during the return.
And I really want to thank you both for being here today. I know how busy you've been, Dr. Stewart, and I imagine Dr. Scrase too during the pandemic, but also with the legislative session winding down. And I just really think it's so important for educators to get to hear directly from you. And we're still going to be vigilant. And Dr. Stewart has been meeting with us since, for a year now, to get information directly to you. And we are going to go through the chat and pull the questions. And we do very much appreciate you taking time. I know it hasn't been easy to be a leader, a state leader at this time either. So, and I know there's a lot of anxiety. There's a heightened anxiety and fear right now. And so we are going to take a little bit of a break. And then we do have our attorney is going to stay and visit with those that would like to hear what our attorney has to say about school reentry and protection. So thank you so much for joining us, and we really appreciate both of you and the good work that you've done.
Can I make just one last comment? I saw a lot of opinions in the chat that were a little different than the ones I expressed, and anyone who has any scientific data, research studies, things like that come to a different conclusion than anything I've said today, we want to see all that data. So I know we all have different opinions about this, but if you have scientific data that points in another direction, please send it my way. I'll get it to the right people and all the people who study this every day, and we'll take a serious look at it. Thank you.
Okay, thank you so much. So we will take a 5-minute break, and we'll come back right at 6:15 with our attorney, Todd Wertheim. So thank you so much, Dr. Scrase and Dr. Stewart. We'll talk soon.
Hey, is that good?
Dr. Scrase, we can still hear you. Thank you. Hi, Todd and Katie. I know that probably hasn't been 5 minutes, but I don't want to keep you
We're ready
waiting.
to go when you're ready to go. So.
We're ready. We were born ready. And I know educators are, their anxiety is going up as April 5th and 6th gets closer. And so we wanted to go ahead and get started. And I don't have direct questions to ask to you. So I'm just going to turn it over to you and Katie. And so thank you.
Sure.
So I'd like to introduce Todd Wertheim. He's our attorney at the Jones firm. And Katie Delvain, and I hope I said your last name correctly, is works with Todd. So over to you, Todd.
Thank you, Mary. Thanks for staying after that presentation, everyone. And I do want to introduce my colleague, Katie Delvain. She'll be doing a lion's share of our presentation today. And we're really fortunate to have Katie. It was fortuitous at the firm when COVID hit, because she has a real expertise in health law that she has really brought to bear on her work with NEA, and has really mastered the intersection between education law and health law. So we're going to talk, we have a frame about it, but we do want to answer as many questions as we can legally. I think we have a pretty good frame on what people want to know about. And I just want to spend 2 minutes putting what Katie and I are going to talk about in context. And I'm going to start with a really important case for all of you as educators, and that is Brown versus Board of Education. And as I was listening to the presentation, and I was looking at Secretary Stewart's guidance that social distancing should be done to the greatest extent feasible, I was reminded of Brown versus Board of Education, because the Supreme Court, because they were arguing among themselves, everyone had goodwill. The schools needed to be integrated. Segregation was evil, but they couldn't agree on a deadline. So they came up with the phrase, all deliberate speed. And if you look at the legal commentary behind that afterwards, if you were in a wealthy, affluent school district in suburban Philadelphia or New York, all deliberate speed was like the greatest thing that had happened since emancipation. If you were in a segregated school in Birmingham or inner city Detroit, it was an incredible dodge because it had no deadline, it had no teeth, no one knew what it meant. Much like to the greatest extent feasible. And we know that we're talking about real serious situations here. So we want to recognize that. But what Katie and I want to do as lawyers for NEA New Mexico today is talk to you as a practical matter about what legal tools do you have going into this reopening, because it's a policy decision that's been made, to protect yourselves and protect your families. And what that is mainly centered around, in my mind, is the existence of the Americans with Disabilities Act. And Katie and I will touch on also the Age Discrimination in Employment Act and the Pregnancy Discrimination Act. So one advantage we have is not going back to the 50s and Brown versus Board of Education, is we have some powerful tools that are still in place for all of you to do your jobs as professionals, which I know you want to do, and also protect yourselves when you can. So why are we going to talk about that? We're going to talk about that because what has been made clear through the reopening guidance is that high-risk individuals get their automatic exemption, and they get it through 2 weeks after their last shot. We know there's a medical reason for that under Pfizer and Moderna, right? 2 weeks, 14 days after your second shot, you're at the maximum protection possible, presuming you're not infected with one of the new variants where the data is mixed depending on the variant. So that's why the PED did that. But what they said is after you reach that that automatic exemption was not the ADA exemption. That was just kind of, as you all know, an automatic exemption. I'm at high risk. I don't have to do any work in person that would expose me to COVID. But what's important is that doesn't change the ability and the right to have accommodations under the Americans with Disabilities Act. And in fact, the PD has recognized that at that time, meaning after we're out of that period of time, the staff in the school or district should engage in a discussion about whether and to what extent further accommodations are appropriate. So with that, I'm going to turn it over to Katie to talk about what that looks like with reopening and the current state of the law around COVID-19.
Great. Thanks, Todd. So I've framed most of this discussion around the question from the individual teacher who says, I have a condition that the CDC has listed as putting me at a higher risk of severe illness from COVID-19. And the question being, will I be required to report for in-person teaching after I'm fully vaccinated? Or in the case that I can't or refuse to take a vaccine after I've been offered a vaccine. So the same change from PED applies if you choose not to be vaccinated or cannot be vaccinated for some reason. This automatic exception process goes away after you've had the opportunity to be vaccinated. So before I jump into the ADA and other laws, I just want to point out that we're talking about the legal boundaries here, but schools and districts, you should always remember, can choose to offer greater flexibility than what's required by law. So we encourage you to bring this up in bargaining. And as far as we know currently, at least one district is choosing to extend the automatic exemption through the end of the semester, and they have the choice to be able to do that. So that's something to keep in mind, but this advice is going to be about requesting an accommodation under the ADA and who that might be a good idea for. So first, I just want to address a little bit of confusion about these high-risk conditions that have been identified by the CDC, the Centers for Disease Control and Prevention. This is the list everyone's referring to. This is the list that if you fall into one of those conditions, you were getting an automatic alternative work assignment until you've been vaccinated. The list from the CDC doesn't have to do with vaccination and does not change based on vaccination. It's an evolving document, basically, based on new scientific information available to the CDC. So they've added conditions to it and changed it throughout the pandemic. But just being vaccinated doesn't change the fact that you could still be on the list of individuals who, based on a medical condition, are at increased risk for a severe course of illness with COVID-19. As I'll talk about and give some examples later, it could reduce your risk enough that an ADA accommodation is no longer necessary, but that's not necessarily true. And obviously we encourage everyone to be vaccinated when it's offered to you, if that's something that your healthcare provider recommends. So the other thing, when we're talking about the Americans with Disabilities Act, not everything that's been identified by the CDC as increasing your risk for illness will qualify as a disability under the ADA. So two groups that are clearly at increased risk right off the bat, older adults and pregnant people, are typically not covered by the ADA unless you have another underlying condition that qualifies as a disability. So the barrier to entry with the ADA is you have to have a condition that meets the definition of a disability. For example, if you're pregnant and you have an underlying condition along with that, for instance, gestational diabetes, then we can get into the realm of that would qualify as a disability. But on its own, age or pregnancy isn't going to most times meet the definition. So for those groups of people, things to keep in mind are that you're still entitled to a safe workplace. And I think the link has been shared for folks to report things to NEA New Mexico and PED if the COVID safe practices are not being followed or you don't have adequate PPE. So we definitely encourage you to stay on top of that and reach out if you need help identifying those deficiencies. And then as Todd already mentioned, there's the Age Discrimination and Employment Act and the Pregnancy Discrimination Act and state laws that correspond with those federal laws. And these just mean that employers can't treat you differently based on your age or based on your pregnancy. So keep in mind that you do have rights, but the ADA might not be the avenue for you if you don't have what qualifies as a disability. Okay, so for those who think that the ADA might apply to your condition, first off, a person has a disability if they have a physical or mental condition that substantially limits a major life activity. Just some examples of that are walking, talking, seeing, hearing, learning, or operation of any major bodily functions. That includes the immune system, which is relevant for folks who have conditions that increase your risk of severe illness from COVID-19, which is again what we're focusing on here. So keep in mind that you could have a condition that qualifies as a disability, and before the pandemic, you've never needed to seek an accommodation for it. But because the condition coincides with an increased risk of severe illness, now you would qualify. So if your condition was well managed in the past, it can still be appropriate for an accommodation if it's increasing your risk for severe illness. I'm going to stress multiple times now that the most important part about the accommodations process under the ADA is that it's an individualized assessment of your risk. So like I already said, for some folks, the vaccine might reduce your risk to a level where your healthcare provider says that you know, you're at a normal risk level now. And for others, it just depends on your condition and how your current picture of health and your current circumstances of whether you might still be at an increased risk after vaccination. So as far as how to request an accommodation, and as far as the timeline right now, we encourage folks to get on this as soon as possible. You don't have to wait until you're in full reentry mode, just anticipating that it's coming. You should start speaking with your local employers to start the interactive process under the ADA to have a dialogue and see what extra information they might need and what's going to be possible. So the accommodation that I'm really talking about here is for people who are still at increased risk, being able to continue to work remotely through the end of this school year. Again, it could be different based on your individual risk level and circumstances, what's an appropriate accommodation. So we have shared with Earl and Mary, and I'm sure they can send it out. We did an advice memo back in July about what should be included in a doctor's note with a request for ADA accommodations, and that's a good one to review if you want some background. And we've also shared 2 templates. One is a letter to your employer making your formal request for an accommodation. I want to stress that there's no template that's required to request an accommodation, and an employer is required to engage with you in that interactive process as soon as you indicate that you have a disability that you need to be accommodated for. But we strongly encourage you to put your request in writing. So we've provided a template letter that you can use, and we've also provided a template healthcare provider note. If your healthcare provider needs a template, often they might have one of their own that they like to use, but they might also be very grateful to get a template from you. As far as the letter for your request, also keep in mind that your school or your district might have a template that they want you to use. So you can also reach out and ask them. So as far as the last thing, and then maybe we'll have time for a couple questions, otherwise we'll follow up with them later. But I wanted to give a few examples of people and conditions that we might consider for accommodations now that everyone's going to be vaccinated and the automatic exceptions are going to go away. So I have 4 examples and then I'm done. And all of the examples I've given are of people who would be eligible for a vaccine in New Mexico's phase 1B category of persons who are 16 or older with a risk of COVID complications, which again comes from that CDC list of medical conditions that could increase your risk for severe illness with COVID-19. And I just want to go through to show how being on that list and having an automatic exception until now doesn't necessarily translate to an ADA accommodation, but in some cases it will. And I want to stress before I go into this one more time that you could have a condition that's not on that CDC list and be at an increased risk and need an accommodation right now. The CDC list is not all encompassing. It's a good place to start though if you're wondering what the conditions are. So my first example, this is a clear example of someone who would not be eligible for an ADA accommodation. So you're a 35-year-old teacher with a BMI of 27, so body mass index of 27. You're physically fit, you have no other underlying conditions, and your higher BMI level could be attributed to a high muscle mass. Maybe you're like a bodybuilder. In New Mexico, if you have a BMI over 25, that's considered overweight, so you would qualify for a vaccine as someone over 16 with an underlying condition. But in this example, this person clearly doesn't have a disability. They're probably not considered overweight by their healthcare provider based on their individual circumstances. They don't have a physical condition that impairs any of their major life activities. So we would not advise this person to seek an accommodation. So second example, someone who would clearly be eligible and want to be seeking an accommodation right now. You're a 50-year-old teacher with a chronic condition and you're taking an immune weakening medication for that condition. The condition would be a disability. I haven't put down what it is, but assume you have a condition that is a physical condition and it impairs one or more of your major life activities or your bodily functions. The immune weakening medication you're taking puts you at a higher risk for severe illness from COVID, and the medication's effect on your immune system might also decrease the efficacy of the vaccine for you. So the vaccine also isn't going to reduce your risk by as much as it will for other individuals. This person should clearly talk with their healthcare provider, get the note, request the accommodation. My last 2 examples are both to do with diabetes, and I just wanted to use these to demonstrate the importance that this is an individual assessment and it's a discussion to have with your healthcare provider for who's at risk still, especially after a vaccine. So first one, you're a 42-year-old teacher with well-managed type 1 diabetes. You're in good health. You have no other underlying conditions. Obviously, reach out to your healthcare provider if you're not sure. But this person is less likely to still be at increased risk for COVID-19 after being vaccinated. Last example, you're a 67-year-old teacher with type 2 diabetes as well as heart disease, and your diabetes isn't currently well managed. All of these type 2 more so than type 1 has been identified more so as increasing your risk for severe illness. Other underlying conditions on top of the diabetes, such as heart disease, further increase your risk. And if the diabetes is not well managed, it further increases your risk. So this person, again, we would say, first off, just talk to your healthcare provider, but more than likely you can meet the definition here of a disability, and you might still be at increased risk after you're vaccinated, and worth discussing with your healthcare provider. And with that, I think that's everything I have.
Great, thanks, Katie. Let me I think we're scheduled to go to 6:40, so I'm going to quickly close the loop and then try and answer some of the, Katie and I will try and answer some of the questions on this. What the reason we're emphasizing this is that this is a process by which you can practically protect yourself if you're at high risk. And it has teeth. And it also requires concerted action. I mean, I think there is a level at which, and I read the chat, both of the secretaries are men of goodwill who want to try and get this done. They are also buffeted by different political winds. And that's where law comes in to protect you. Now, what they have said, folks, is in the guidance, they have said related to this, and high-risk employees, all districts and schools must provide notice that alternate work is available to staff who are in the high-risk group. So it's up to them to provide notice that you have this. The ADA doesn't require it. So that's a slight place where in this political battle that they're working, they have said something that is beyond the ADA. Now, typically, you have to start the process unless it's very obvious to the employer under the ADA. But here they're saying you have to be given notice and that they should establish a process that includes formal requests to continue working from home. The process should be aligned with the districts and the school human resources department. But what Katie and I understand, what you should understand, is what's behind that is this very vigorous process that is required by law. And so it is so important that we not get cowed or get such a sense of fatalism about protecting ourselves that we don't engage in this process. So start now, and we are hopeful that we can protect you and that the law can protect you. The last thing I do want to note is there's another slight deviation from the ADA and the FMLA and some of these other statutes. And what they did say in the guidance at page 22 for reopening is that for staff who live with someone who is in a high-risk group as defined by the CDC guidelines, local board policy should be established and will dictate procedures. What needs to be understood, and people may remember this from our presentations in the fall, is that the ADA doesn't protect family members. It protects you as an employee. The FMLA potentially protects family members. It's a slightly different definition for the family member having an illness. And that was extended under the original coronavirus, the CARES Act. That expired on December 31st. What's being said here is that your district should have a procedure to allow you, if you have a family member in the high-risk category, to stay home and work remotely through the end of the year. So we want to hold them to that guidance as well, because it is a place, again, we're in this political push and pull. That's why I started with all deliberate speed. You know, that's how you get compromised. But this is a place where they've clearly said, you should have rights beyond what is given to you by the FMLA and the state equivalents. So with that, Mary, do you want to ask some questions? Do you want us to, how best to handle that?
So I'm looking, where can I get the templates? Yes, so Edie is going to put an email address that will for people to watch for their member alert tomorrow. Okay, we're going to send out a member alert tomorrow, and the documents that they're referencing will be in there. And so let's see what else people are asking us for. In your email tomorrow, yeah, there she said it. Thank you, Edie. Let's see. What about accommodations for employee who has a family who has asthma and anaphylactic reaction to a food allergy? What about accommodations for an employee who has a family who has asthma? So you want to answer that one?
What I
Sure.
think that goes to what Todd was saying. Yeah.
Right. So I think, and this is an opportunity and why Katie emphasized bargaining. Remember what the guidance says. For staff who live with someone who is in a high-risk group, as defined by CDC guidelines, Katie is encyclopedic on this, but my recollection is asthma is a high-risk group under the CDC guidelines. Local board policy should be established and will dictate procedures. So depending on where they say local policy, the other political push and pull, right, is collective bargaining never gets mentioned because we're their friends until we try and collectively bargain and then everyone gets upset. But so it's not just board policy and it's not just dictating procedures. These are plainly terms and conditions of employment. These are plainly the impact of the decision to return to school. We're litigating that in front of the labor board right now, PLRB. But our point is, get that into bargaining. We want a procedure pursuant to this guidance, page 22, on how I can stay home with my asthmatic child because she cannot go to school under the CDC guidelines. She's unvaccinated. Socially, 6 feet is not enough. Her doctor doesn't want her back. I need to stay remote to take care of her. So the other tool we have on that front, folks, is they've made clear and they've done a fast track procedure. They've sort of recognized that younger children need more in-person instruction perhaps than secondary students do. And that therefore there may need to be a reshuffling of, and there can even be licensure waivers to permit this to happen. So in the case of the asthmatic teacher, and then the question with the asthmatic child, if you're teaching elementary and your school district saying you will come back because there's going to be more kids, the guidance says, hey, I would rather be transferred to the high school, and it doesn't matter that I'm not certified to teach secondary history. The PD is going to give me a quick waiver. And this is another thing we want to do, and we'll put this in the guidance. They say, email it in so that I can teach history remotely for the next 7 weeks and take care of my child. That is something that is contemplated by this guidance and that is outside of the ADA accommodation. Because remember, if we were not in a COVID environment, you had that problem, the ADA would not protect you. You'd be looking at taking FMLA leave.
Okay, so I have been looking in the chat and it occurs to me that there are several people that are writing about some very specific issues, and we can't address those issues right at this moment. But what should you do if the district is dragging its feet, if they're telling you you have to go back, is you need to get in touch with your UNISERV director, and if you don't know who that is, contact NEA New Mexico and we will let you know, or your local president, because a lot of these very specific issues will need to be addressed one-on-one. But with that being said, what Todd and Katie are talking about should give you some blanket protection. They just can't say they're not going to do it anymore. So where can I get a copy of that page 22 of the guidance? So let's see. So best employees, families to stay remote.
Mary, do you want us to, as we did the last time, Mary and Earl, we can, to the best we can, try and do some short written answers to some of these questions, and then that can also be posted.
Yes.
We can't guarantee that we have an answer to everyone, but we can certainly answer a lot.
Right, and there are a lot of questions about sick leave. There are questions, and this is why we have, well, why we're members of a union, because we are stronger together, and because we can seek answers from our attorney, and we can get the PED to speak directly to you. A lot of times what the public education department is saying and the state, they are saying and doing the right things, but where there's a breakdown is in the district. It is with the local superintendent and the school board, and that's where the advocacy needs to be done. So, but we are happy to work with everybody that are in these situations. So yes, if Todd, if you we'll get you a list of the questions, and then if you can do like some blanket answers, we will email those out to everybody on the chat, and probably when we send out our member alerts. But we're not going to be leaving anybody at this critical time. We're here, we're all in this together, and we take these things very, very seriously. We know people are scared. And that's why we're going to continue to, to have these forums so that we can get as much information to you as we can. So with that, I want to thank you. Thank you so much, Todd and Katie, for being here with us. Thank you to the staff, and I know Dr. Wyman and Edie, and also the staff, our UDs that are on the webinar with us tonight. We really appreciate all you're doing, and to all of the NEA members on the webinar and all the local leaders. It's a tough time. It's a really tough time for all of us, but we are going to get through it. So we need to stick together, and we will get through this. So thanks everybody for joining us tonight, and we will be talking to you very, very soon.